Welcome. This is your Vans. That's right, Kopi with Vans. Yes, today is Wednesday and 9 p.m. and I'm live and you are live. I'm sure a lot of more viewers are coming on board. And yes, today our topic is what is colorectal. And yes, this topic about colorectal we have never covered in Kopi with Vans. So it's really honor to have Dr. Chong who's going to jump in a while. But before that, let's just give a little bit of introduction before Doctor comes in, right? Welcome to today's podcast, and I'm very, very excited to be discussing together with Dr. Chong on the essential but often overlooked on this topic, right? I mean, like I said, for the past 3 years, we have not covered this. And colorectal health, according to stats, colorectal cancer is the most commonly diagnosed cancer. Nowadays, cancer is so scary. So we're going to ask a lot of questions to Dr. Chong as well about the awareness as well. So it's essential to learn more about the colorectal system and the measurements we can take to prevent and manage the colorectal health issues. Often we have instruction manual for cars, for fan or computers, but for human body, that seems like we don't have instruction manual. But we have Dr. Chong, the main guy to talk about colorectal, and he's the manual itself. So let's invite Dr. Chong. Hi, Doctor.
Hey, hi, Vince. Thanks for inviting me.
Thank you for joining me at Kopi Events, Doc. It's a pleasure to have you in my show. Thank you so much, Doc.
Thank you. Yes.
Doctor, before we jump in, maybe if you can just do a quick introduction of yourself, where you're from, and then we can just dive into the topic itself.
Okay. Well, so I'm basically a colorectal surgeon. Currently now working in Mount Elizabeth Hospital. Previously, I was from National University Hospital, and prior to that, Tan Tock Seng as well. So it's a privilege to be here to share about some things about colon care and colorectal cancer. And it's kind of like the thing that I do for, almost the entire 20 years, what I've been training in. Yeah. So, yeah.
Thank you, Doctor. Before our podcast, I'm not studying for MBBS, but I try to gather some information so that I can have a great communication with you. But, it's a bit scary, right? About this colon cancer. Of course, we're going to look at the signs and symptoms and we're going to talk a lot about it. But it can be with someone and he perfectly normal and live a good lifestyle without any indication. So, this is a bit scary, Doc. And also with looking at the stats, where are we right now in terms of locally, Doc?
Yeah, well, colorectal cancer is the number one cancer in Singapore, actually. And it is the most common in males and the second most common amongst females in Singapore. So you're absolutely right in that it can be asymptomatic. That means when the patient has an early cancer, it's very likely they probably have very mild symptoms, or some don't even have symptoms. And these are people who actually get picked up when they go for screening, which is something that I think we'll talk a little bit about later. Right. And because it's so insidious, and hence you find that there are a lot of media coverage in talking about how do we get patients to be screened and who should go for screening. Yeah.
And Doc, of course, we are going to go into the few questions to dedicate it to you to answer the best person. Yeah. But talking about that, those not say gadgets, but you have all these medical equipments that you use. Are they a bit scary? To look at it,
Well, it depends on who is looking at it.
Looking at it. You have more devices and equipments. So how does it look like? Or do you want to explain to us before we jump into that?
Yeah. Well, the most fundamental equipment we use for detection of cancer is basically a colonoscopy, which basically it's this long flexible tube that goes up through the rear passage,
Okay.
Trying to censoring my medical jargon and words. But as you imagine, it's something that sounds pretty awful and uncomfortable, but the actual fact is actually it's pretty much painless. Yeah.
Right.
The procedure itself is pretty simple. It takes at tops maybe 20 minutes or sometimes half an hour. And it's done under sedation, and some actually go through with anesthesia.
Okay.
But there are patients who go through it without any medications and they're perfectly alert and still there's minimal discomfort and no pain. Yeah.
Mm-hmm. Mm-hmm.
So it's kind of like a very long tube and it's small. Yeah.
All right. Okay.
Yeah.
You know, thank you for that, doctor. Definitely,
Too
for
graphic,
even
no?
myself. Uh, when we talk
Yeah.
about this word cancer, it's a bit very sensitive, and also people are actually very
Yeah.
worried. What
Yeah.
if I've, they sometimes denial, trying to avoid a lot of screening, and then even look at current our government is actually pushing a lot for these screenings to be done, early
Yeah.
detection,
Yeah.
preventions and all
Yeah.
that. But
Of
is it
course.
a fear someone has it? Is this the reason
Well,
why people don't want to come for screening?
okay, I think the studies have also shown that there are pretty much a few main barriers towards or rather against screening. There's of
Right,
course the first of all is a denial. A lot of us actually feel that we'll be fine, and especially when you don't have any symptoms, you kind of feel that it's not you. Like cancer is common, but it's not going to happen to you. So
right,
that still fulfills a large part of the people who do not come for screening.
right,
The two is what you mentioned, the fear of knowing, which actually happens more and more in the I would say the developed countries like
right,
Singapore, and in US it's also pretty common,
right,
where maybe people are more fearful about the burden of disease rather than actual mortality from the disease. What
right,
kind of burdens do they come in? Financial burden, the loss of independence, the burden of societal perceptions. Like some people feel that like, oh no, you will lose autonomy, you will become
right,
dependent. And there's also I mean, sometimes it's also the fear of having the disease itself in terms of like,
right.
you kind of like, oh, is your appearance going to change? Are you
Yeah.
going to be very tired? The quality of
Hmm.
life drops. So these are the
Hmm.
common fears that lead to barriers of not wanting to go for screen.
Right,
Uh, I mean, in Singapore, most patients, especially the elderly, because they are still pretty much not as educated. The bigger burden is still the ignorance lah.
right.
They kind of felt that like, yeah, that no, it's not going to happen to
Yeah.
them. They felt that cancer is incurable,
Right,
and that becomes like, okay lah, so if I get it, I'm just going to die anyway, so why do I go and find out? So
right,
that becomes another problem, the problem of ignorance. Yeah.
right, right. So this is
So those
a
are the
few
three
questions
main
there.
things.
Right.
Mm.
Thank you, doctor. So these are the things that we're going to ask you, right? I mean, prevention is always better. Screening
Mm.
is always necessary.
Yeah.
And also to psychologically, I think they've also been affected. Oh, I don't want to know about it. So today we're going
Yeah.
to go into understanding about about the colon that we want to talk about,
Mm-hmm.
because this is where you are an expert.
Okay.
Blood in the stools, doc. I mean,
Yeah.
is it something serious that someone should concern about?
Yeah.
Sometimes we call the piles, or maybe that could be the
Mm-hmm.
thing, or it's okay, heaty, some home remedies, they think it's fine. I will all monitor for another 2 more weeks or 3 more weeks.
Yeah.
I'm going to drink a lot
Yeah.
of coconut or ice water, and to bring down the body temperature. Is this really a myth, or is this something that we really should concern about?
Okay. Okay, good question, Vance. And I shouldn't be saying this, especially on live, but yeah, I'm
All right.
kind of like one of those people also who I thought I may be heaty and let me just
Yeah, no,
monitor
yeah,
for a while.
yeah.
I think the I think we have to know a few things. Lah. Number one, actually bleeding in the stools is pretty common, right? And it's estimated like 20% of people who actually have bleeding in stools do
Right,
not actually seek any medical treatment in the first episode. So that's
right,
like very common because most people were like, okay lah, just watch and live with it for a while. However, it is also reassuring that the fact that most people with bleeding in the stools uh, actually do not have anything serious. And the most
right,
common diagnosis is still pretty much like what you mentioned: hemorrhoids, piles,
right. Piles.
anal fissures, which is like a tear in the anus.
Yeah,
And those are easily treated with medication, and sometimes you kind of need just some modifications with your lifestyle. I mean, the
right.
constipation being the kind of the most common cause, and so you kind
Mm.
of need some stool softeners, a bit of increased fiber and water in your diet,
Yeah,
and you
definitely.
get better. And once they get better, and if it doesn't recur, then fine and good, right? You don't
Right.
really need to see a doctor. So, but
Yeah.
when the symptom becomes recurrent, when the bleeding happens again, and a lot of times, if the bleeding somewhat scary, that's when most patients will eventually turn up, either seeing a GP, a polyclinic doctor, or coming to see a specialist.
Right.
Because the bleeding can be quite torrential. The whole toilet bowl can be stained red,
Okay.
and and
Right.
and that really frightens them. Like they're gonna
Mm-hmm.
bleed to death.
Mm-hmm.
And generally, yes, cancer can present with bleeding in blood in the stools. But there are other diseases that can present with blood in the stools,
Right.
like sometimes infection, sometimes they have this autoimmune condition. And generally, if those are the suspicion,
Mm-hmm.
after the doctor sees, a colonoscopy will then be advised.
Right.
uh, who are the people that we are worried about these conditions? Actually, it mainly falls in the people who are more or less 40 and above, right? More or less. Because cancer is just not as common in patients who are less than 50 years old. And if you talk about other causes of bleed, again, those are more common above 40 years old.
Yeah.
Perhaps the younger age group, we are more concerned if the bleeding is, I would say, recalcitrant, or if it really doesn't stop with any medical treatment. Then those are also the kind of worrying signs or symptoms that we look out for, and then we will advise them to go for a scope accordingly. Yeah.
Right. Doctor, along the line also, I'm
Mm.
actually a regular blood donor. Been
Not
donating.
through the back passage, right? Nah, just
No,
kidding.
no, 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 no. This is my plasma I'm donating. I got you there. But
Okay.
doc, every time when they give me these iron tablets, right, I really freak out
Yeah.
because when you go
Oh yeah.
for
Yeah,
your
yeah.
poo is like the darkest color because of iron.
Yeah.
So is that something that one should be worrying about? Because some can be iron deficiency, and then when they start taking in iron tablets, they see
Yeah.
that these poo colors are like really dark and very you
Yeah.
know not a very pleasant looking, or rather
Yeah.
not at all. What is it? What should be one should be worried about that?
As in the color of the stools, right? Did I hear that
Yeah,
correctly?
color suits, yeah.
Yeah. So, if it's fresh red blood, or you could say that it's probably the pathology is more in the anus, like piles or fissures. I mean, you can have cancer in that region also, but in general, if the blood is dark, like, it's a bit more purplish,
Yeah,
and the other thing is that if they are like mixed with the stools, they're not really after your
right.
stools or on top of stools. Now, those
Mhm.
are kind of the symptoms that makes you a bit more worried about
Right,
a more proximal. By proximal means that the lesion or the pathology is more
right,
higher up in the large intestine,
right,
and that usually warrants a scope, lah, endoscopy.
right, right.
Yeah.
So
Yeah. In terms of
there's
color,
nothing wrong. So there's nothing wrong to look at the pool after you do your businesses.
oh, perfectly. That's what I do
Yeah.
every day.
Okay. Yeah, because most doesn't do that. It's like, hey, I'm not watching some movie.
I
I
know.
think it's
I
signs and
know.
symptoms, right? I mean, you should know. One should take care of
Yeah.
their body, right? Hey, why are you looking at the
Yeah.
pool? I mean,
Yeah.
of course, you don't tell everybody, but I
You
think,
know,
yeah,
yeah, this is the thing that I always get reminded about. The movie Jurassic Park, the very original
yes,
one,
yeah,
where
yeah,
the guy just punch you right
yeah,
in, and then it's like,
yeah,
and you could literally tell what's going on wrong. So I
yeah,
think that's like an analogy of, like, how our stools can be an actual reflection of
right,
how our inner life or our inner
right, right,
health is. So I think we
yeah,
should really be mindful, lah. I'm not saying
yeah,
that you need to like stare at it or smear it
right,
on a microscope,
right.
but you kind of should know how it looks like. Yeah.
And also, doc, I mean, see, we consume a lot of food on a daily basis. We're
Yeah.
taking so much of food in a human life. I think the whole
Yeah.
life, I think we're taking tons of food. But, doc, the digestion happens, the enzymes,
Mm.
the
Uh-huh.
microbiome. So there's so many things. Of course, we're not going to go into that. But, like
Yeah.
doing simple observation, just looking at the stool or looking at
Mm.
how hard it is, or maybe if you're not taking fibers, I think
Mm.
regular observation is very important. And I think, like,
Yeah.
if you find some sign and symptoms, I mean, one individual should definitely
Mm.
approach a doc, to like a professional yourself, to understand what exactly is going on me, to
Mm-hmm.
prevent a lot of other issues, right? I mean, we can
Yeah. Yeah.
prevent just by looking at it and not looking at the symptoms.
Yeah.
I'm going to go into the next question, doc, but before that, I'm going to also ask a couple of other questions which is
Sure.
not prepared for you.
Sure.
If, let's say, if one is diagnosed with a cancer, is
Yeah.
there any chances that it can be reduced, or is also a game that
Mm-hmm.
depends what's going to happen, what will happen during that
Mm.
process?
Yeah. So in general, if you talk about like cancer treatment, right, it really depends on the stage of cancer at the time of diagnosis. Hence, prevention is better than cure. Early detection is definitely better than late detection. So,
Yeah.
well, you have this spectrum. If you range from stage 1 to 4, where stage 1, a lot of people do not know. It might be as easy as just getting the scope done, and the tumor can be removed with the scope.
Wow.
Is that
Okay.
amazing? Yeah, and
Yeah.
no cuts, no surgery, no chemo, no
Right. Yeah.
radiotherapy. And because we see that, see, and because as a physician, you're like, wow, that's what makes all this tech and
Right.
education so meaningful. Because
Right.
when you pick that up and you remove it, literally the next day you tell the patient like, you're kind of cured, and you
Wow.
just need to go for regular surveillance. And they're like, what? I actually have a cancer? I never knew, and now
Yeah.
it's removed. And like, wow, like things went up from one day, and the next day it's like, hey, it went back again. So
Yeah.
that's kind of like the amazing part. But as the stage advances and progresses to like maybe stage 2, stage 3,
Right.
and again some of the stage ones that the tumor is a bit bigger, you can't really remove with the scope, then you got to do surgery. So
Okay.
surgery,
Yeah.
it remains the mainstay of treatment. You have to
Right.
remove that part of the colon or the intestine, and then you
Right.
try to then join back the other two ends of the intestine.
Right.
When it comes to stage 3 and going to 4, then you gotta add on, other than surgery, you gotta add on like chemotherapy, and some may need radiotherapy, and it might be
Yeah.
given before or after the surgery. So
Right.
things get really complicated, especially when it's stage 4. Then what it means is that it has kind of like spread. Then you don't just have to treat the colon, you have to treat the other organs that's involved,
Yeah.
like the liver, the lungs,
Yeah.
and things get really protracted. The treatment can be as long as a year plus, and
Yeah.
and of course you expect that the quality of life really comes down, because you're not just subjected to like the pain of surgery, you're also
Right.
subjected to like chemotherapy and all the side effects.
Right.
Yeah, so early detection is really the mainstay of trying to get a better outcome and quality of life out of all this. Yeah.
Doc, in this point of
Mm.
time that we are talking about this, what is colorectal, and also
Yeah.
going into the colon, the human body has so many organs: the liver, the kidney, the
Yeah.
gallbladder, the heart, the lungs,
Okay.
the bones, the bone marrow. But one got to do so many tests and so many, and our local
Ah.
government is always pushing, go for screening, and
Yeah,
now you look at
yeah,
it,
yeah, yeah.
the
No
cancers
end to
and
it.
yeah, no end to it. So you know
Uh,
what is important,
yeah,
which one to look for, whether you should go for the heart or whether you should go for lungs, or go for the colon,
yeah,
which is
yeah. I mean, yeah, okay. So, okay, this is not like a
half,
government speech,
half,
but really,
yeah, yeah,
it's.
half
I
question.
mean, Singapore's public healthcare is really good, lah. It's solid. It's this practice is based on evidence, and if you look at like the leading cause of mortality and the burden of disease, I mean, chronic illness is still number one. So
Right.
I'm not talking about cancer, I'm talking about heart attacks,
Yeah.
diabetes, cholesterol. So if you want to choose one thing to do, please do that first. Go to your
Right.
GP, polyclinics, get it checked first. Because that's really, really that common, and you can do something about it when you're young. It includes like what you do, events like get people to be motivated to train, to exercise. You kind of like have to take control of your lives at a young stage, and that itself actually also has bearing towards prevention of cancer, because obesity is related to cancer. I mean, some would say that diabetes is associated with cancer, and by doing all this healthy lifestyle measures, like what healthy SG is about,
Right. Yeah.
I mean, that I think will really go the longest way. Then, if you look at all the different cancers, I think we shouldn't be overly worried about all different types of cancers that can happen. You're right, there's like too many. I can't
Too many.
even name everything. Yeah, it's just, and it's impossible to expect a comprehensive test that will test for everything, because you're going to like test like a million people before you pick up the rarest cancer in the body,
Right.
and that's not really what screening is about. So you will go for, or one would reasonably say that you should go for the common cancers, the cancers that happen commonly. So
Right.
for females, it's breast cancers, and you have cervical cancers that you do a pap smear, and the breast one
Right.
you do a mammogram. For guys, it's really boils down to colon cancers where you do a scope. Likewise, for female, you should get a scope. And then you have like prostate cancer, which is the second most common right now. Well, the
Right.
statistics just for the last 4 years, prostate is second. So you kind of got that check as well. And that one you could check with like just examination and a blood test.
Right.
Then you have the rest, like lung cancer, stomach cancer, which unfortunately there's really no great, like way to test for them. But
Right.
we have scans and we have stomach scopes. So in those cases, we kind of pick and choose. What do
Right.
I mean? I mean that you choose the people with the higher risk factors to go for it. You don't
Right.
really need to screen the average population because that's like what you are mentioning. It's just, wow, it's cumbersome. Do I really need it? I have so many things to do, and
Yeah.
that increase healthcare costs. So
True.
you just need to pick and choose the right patients to go for like screening for the other cancers. You shouldn't probably do it on a population wide basis,
Right.
right? And that also, like, from the individual, it will seems more manageable, right? So
Right.
chronic diseases first, common cancers, and I think that's about it. Yeah.
Doc, I mean, you mentioned, all type of cancers. Thank you for that great information. But also, you see,
Some.
the cells, our own cells are turning against us, right? And
Wow.
of course, medical science is always trying to find out what is this happening every day. It's a new thing,
Okay.
and I'm sure you're also studying right now, constantly studying. I think
Yeah.
doctor's education, there's no stoppages because always look
Okay.
very
Yeah.
serious. Uh,
Yeah.
but on a serious note, even if you do like a blood test, check for your cancer markers, will that actually help? Like basic stool test,
Yeah. Yeah. Yeah.
do you think that is necessary? Or even for we talk about the colonoscopy scopy, is it necessary
So
to do it like a yearly?
yeah. Okay. So I think I will speak from the colorectal cancer
Yeah.
perspective, right? So other than colonoscopy, you have stool tests and you have blood tests and then you have CT scans. Okay, so
Right.
four different modalities.
Right.
Uh, to be clear, actually the only ones that are recommended is the colonoscopy, the stool test, and maybe
Hmm.
the blood test is
Right.
not routinely
Right.
indicated. In fact,
Right.
the problem about the blood test for colorectal cancer is that it's not really that accurate.
Hmm.
It can be normal in patients with cancer, but it can also be elevated in normal patients.
Right.
So it's like a double whammy.
Right.
Why do we still do it? I think one of the main reason is because there's not really a better blood test marker for colorectal cancer yet.
Right.
Like you said, the evidence is advancing. People are looking at micro DNAs. They are looking at different types of biomarkers, but none of them are really, proven to be as
Hmm.
effective as the others that have mentioned. So which one is the most effective? I would say that
Right.
colonoscopy is the most effective because it's the definitely the most accurate, as well as the very fact that it could take biopsies, you could take
Right.
histology, you could take tissues on top of just picking it up.
Right.
Stool test is the most cost efficient on the population basis because it's
Right.
like not invasive. Literally, you could do it for like many people, and it's not as resource involved. As in,
Right.
it's lighter on the national resources,
Right.
but at the same time, it's not as accurate.
Right.
And the thing about stool test is you got to do it like every year. If you skip a year, it actually lowers the accuracy when it's already not as accurate. Whereas the
Right.
scope, the question that they had was that how often do I have to do it? If you are an average risk individual, means you don't have any family history, you are otherwise well, you don't have other cancers, you could literally do like every 5-10 yearly. Now, why is
Right.
there a range? It's because it really depends on what was the finding on your scope. If your scope have a polyp, then you probably have to do it 5 yearly.
Right.
And if your scope is perfectly normal and it's
Hmm.
clean, and the bowel preparation is fine, it's like beautiful, it's clear, 10 years is actually the recommendation.
Right.
So that actually makes colonoscopy like the first choice. And the last modality you mentioned is like scans. So why not scans? Well,
Yeah.
scans, if you do CT scans, you kind of need to do it with a bowel preparation as well, like the scope, because they need
Right.
to pump gas in this colon to
Okay.
see it clearly, and that can also be uncomfortable. So it doesn't mean the scan is actually less comfortable. In fact,
Right.
it can be quite uncomfortable. And if you pick up something, you still need to go for the scope. So
Right.
instead of doing one procedure, you're now doing two.
Mhm.
So if you ask me, I think scope is probably the preferred choice amongst all the
Right. Right.
modalities.
Right.
Yeah.
So we talked about, whether is it comfortable, uncomfortable,
Or
painful. So
painful, yeah.
yeah.
It's really not it's really no hoax here, because I
Right.
went through my own colonoscopy
Yeah.
and I didn't require any sedation.
Oh, you
And it was
didn't?
okay. Yeah, it
Wow.
was okay. I was looking at the screen all the time. It's not that I don't trust my surgeon. My surgeon is
Huh?
good.
Okay.
It's just that like I kind of want to go through it to understand the
Right. Right.
feel.
Right. Wow.
And I realized, yeah, you can feel a bit awkward because you can
Okay.
feel something going through your
Yeah.
insides, but
Yeah.
it's actually not painful.
Any
Uh,
sign of a ticklish, of it with pain,
wow,
that could be the
that one
reason.
That one we'll talk separately on
Oh,
off air
okay.
Kopi
Right.
mode
Right.
lah.
Right. Right. Right.
No lah, but
Eh,
seriously, like doing the procedure, you're just
Yeah.
lying on your side and you look at the
Okay.
screen and you're
Right.
fine. And
Okay.
a lot of times, but I still give medications to my
Yeah.
patients because the fact that one of the medications is anxiolytic. What it means is
Okay.
that a lot of patients, because if you have never been through it, you're fearful of the surroundings, the
Anxiety.
lights, you don't know what's happening. Yeah, the
Yep. Yep.
anxiety
Yep.
comes. So that really helps. Once they are calm, the procedure's over. Many of them, when they kind of like wake up, they're like,
Mm,
oh, it's over. And they
right.
never thought that it was as simple as that. Yeah.
So it's also a bigger part of the psychology to come in, right? I mean,
It
you
is.
think of,
It is
yeah,
because
what's going to happen,
remember you asked me what's the equipment and you're like, you've never
yeah,
seen it. You imagine seeing it
yeah, yeah,
yourself for the first time and you
yeah,
imagine that going through up where you don't know where.
yeah, yeah.
It's quite it's quite
I can understand
anxious
that.
actually. Yeah.
And we have already talked about the painful part. I mean, of course, with all
Yeah.
these sedations you have, and we talked about
Mm.
the blood in the stools. We
Yeah.
talk about the cancers as well. But if let's say if one at a recent colonoscopy,
Colonoscopy.
when should
Yeah.
I do another one? You talk about 5 to 10 years. So,
Yeah.
literally, if there's no family-related
Other. Mm.
condition, so one should do at least 10 years once, right?
Yeah. So actually, these are all in the guidelines, and you could
Okay.
look for not just local-based guidelines.
Yeah.
I mean, the updated ones are based in US and UK. You can
Right.
just look at those guidelines, and it's categorized based on your so-called risk category.
Right.
So unless you find a big polyp, or you have lots and lots of polyps,
Yep.
or you have findings that points towards a genetic or a underlying condition we call
Right.
as Crohn's or inflammatory bowel disease, then those patients really need to go for like 2 yearly, sometimes 1 yearly scope, which can
Mm-hmm.
sound very excessive.
Right.
Because the truth is, those patients do have a much higher preponderance or a risk ratio towards forming cancer. So that's why they
Right.
kind of need to be frequently evaluated. But
Right.
for the common folk, and that is like the 90% of all the patients that we see,
Right.
you get one or two polyps, the scope is clear. I emphasize that because the preparation for the scope, you need to like drink this liquid to clear
System.
the system. As long as it's clear and you just have like one or two polyps and all, yeah, 5 years is the actually the recommendation.
Right.
Mm, correct.
Wow. Doc, thank you so much. We're already at 34 minutes. I mean, for viewers who want to engage, Doc,
Yeah.
on
Wow.
any
Nice.
questions, you can talk about it. And we have a lot of comments that's coming up. Zachariah, thank you so much. Great topic indeed. Mr. Arish has said, very informative, wonderful understanding. That's right.
Ah.
Doc, we have few more questions to go on, and
Hmm.
I mean, I have a few questions for you as well.
Okay.
But of course, what happens if someone is farting all day? There's some people, right? Like literally they fart and fart and fart, releasing gases. One, if you can measure how much you had farted for the entire life. Probably the wife or the husband
Fartometer.
would have divorced. I'm divorcing him because he farts all night. Is it so-called a natural process? But if it's excessive,
Okay.
what is excessive?
Okay, so I think it's more of a social problem than a medical problem, to be honest.
Okay,
'Cause okay, so excessive fat though it is not we call a red flag symptom. It's not lah. That means it doesn't really point towards a severe condition like cancer or a serious condition, right?
right,
But yeah, it can be a symptom of what we call more functional related problems.
right,
So one of the most common problems is IBS, which is
right.
irritable bowel
Irritable bowel syndrome.
syndrome. Yeah. So
Right,
that kind of functional problems, though we call them functional, is because there's no like actual abnormal pathology or anatomy. There's no distortion, so to speak, about the person's normal so-called makeup. But physiologically, that means the way that it works, the way they reacts to environment and stimulus is different. So they are a little bit more reactive. So they actually can be a bit more hyperactive, and that's why they can produce a lot more gas as well. And so they
right,
tend to fart more often. But that's
right,
like just one possibility of why a person can fart more often, and it being a syndrome, it's actually not a
right.
serious problem. It can be easily managed again with lifestyle and sometimes medication. So I won't be too worried about farting too much, other than
Also,
the
Doc, can I just
yeah.
stop you for a while? It's because
Yeah.
of too much protein, right? Too much of lentils,
Okay.
too much of protein
So
powder.
yes,
That's
in
why
fact,
we
I was
just
about to come to that. Correct,
yeah,
correct. So in fact, um, more often than not, it's about what we eat. Yeah. So there's interesting research that comes about talking to about like what's the microbiome in our gut.
microbiome. Yeah, microbiome.
Yeah,
Yeah,
right. And how that microenvironment interacts differently between us, the bacteria, and also the kind of food that we eat. Because when we ingest, we don't just ingest food; we also ingest like bacteria as well.
right,
So that environment is, well, I would say, pretty extensively studied, and research has shown certain type of bacteria has a higher predilection in patients with inflammatory conditions where they create a lot more inflammation. That means cells that goes through wear and tear, the like your white cells and things like that, and that
right.
can lead to increase in, again, with inflammation. You have swelling, edema, you can have gas,
Yep.
and that can again result in more symptoms like sometimes even farting. So
All right.
then where does it all lead to? It kind of we don't have the full picture yet, but what our understanding then becomes that if it is if you eat too much food that naturally produces a lot of flavors, lentils, proteins, and I would
Proteins.
say sometimes high in sugar,
Okay.
food that is processed, they will negatively affect the way that we handle them.
You get that. Yeah.
So having the increase in fat to me is not the problem, but how in the long run that affects our gut function and how it affects
All
our microbiome is what I'm more
right.
concerned about when I read all those papers about microbiome. Because I feel that
Right.
I also believe, I'm also one of the believers that I feel that that micro biome environment is
Right.
perhaps the missing link about, we hear that some people they have a perfect lifestyle, but yet they develop cancer. To me, that's
Right.
I feel that that's the missing link. And you have people
Right.
who have all kinds of risk factors like smoking and everything, and yet they seem to get away with
Right.
everything in life.
I-
So
Doctor, if I
yeah.
if I could say something, I mean, of course, probably the
Yeah.
medical science will not have an answer. A
Mm.
place that I go to, a particular condo, because to train someone there, a client of mine,
Uh-huh.
that
Uh-huh.
uncle probably is about 89 or 90 and constantly is
Whoa.
smoking like a train. And I was just
Yeah,
thinking to
like a
myself,
chimney.
yeah, gosh, I mean,
What is
Doc, I
that,
know
man?
it's not,
Yeah.
yeah,
I know. I know.
definitely it's not going to be fair to ask you this, but I know you have
Yeah,
studied.
yeah, yeah.
Doctor,
Yeah.
how is this possible, Doc? I mean, 89 years old,
Walao.
smoking and smoking and smoking, alive and fit, which is, of course, we
Mm.
we want the best for
Yeah,
him.
yeah.
But another
Yeah,
guy
yeah, of
who's like
course.
35 years old, myocardial
Yeah.
infarction, and gone.
Yeah.
So where are
So
we at human life? A bit
that
deep,
one,
deep, deep question for you.
that one go into religion and spiritual.
Yeah,
I mean, no
correct.
lah. There's really no real answer in medical field
Right.
lah. Yeah. There's so many factors other than see so far
Yeah.
everything we discuss is almost like everything that happens in life, right? Like the environment, the food, even the
Yeah.
microbiome. But we also haven't explored much of the genetics.
Right.
So we know that it's an interaction, right, between what genes you have and what kind
Right.
of environment exposure. And again, that's like another big puzzle, right? That's like
Right.
if you look, there are also products in the market that look at like sequencing your whole genome. They
Right.
also want to
Right.
look at whether you are more susceptible to certain. I mean, less than 5% of that whole
Right.
entire genetic mapping
Right.
is actually known for what it really does. That's at least the current understanding. So it's an
Agreed.
enigma, right? It's an enigma that how do people actually form the phenotypic expression of the
Right.
interaction between genes and environment.
Right.
So really, it's not easy to answer that question. For the
Perfect.
uncle who's blessed, God bless
Yeah.
him. I hope that he stops smoking
Stop smoking.
sometime, at least save some money. And but for the unfortunate ones where
Yeah.
they are young, especially I mean this much we know
Yeah.
if you're of Indian racial
Right.
ethnicity, you have a high risk of
Agreed.
heart attack. That's
Yes.
unfortunate. Then
Right.
they really get heart attack when they're young, and it's like oh, so
Right.
all the more they have to be really careful about that
Right.
chronic disease management thing that we talk about.
Right.
Yeah,
Right. And the doc, I mean, if you can just shine some light here, as I was reading some related
yeah,
journal, even for let's say we talk, we are now very close to, in this your topic, the colon,
mm,
even colon
mm,
cancers, right? It can be present in someone, and the person can be fit, running a marathon and lifting weights, and healthy lifestyle, nice body, and kind of stuff, but probably is already as it, and it's been
yeah.
developing to 1, 2, and 3, and probably just waiting to flag up. It's
Well,
by then it's like too late, isn't
yeah.
it?
Well,
Wow.
although it seems really scary and it
Yeah.
has happened before, I have patients who belong into that category.
Ah,
Um, well, they're not that common lah. Yeah, I mean, if the person is really that active in life,
right.
you'll be surprised. In fact, that's how I think nature has its own laws and regulations. Because
Right.
when you're constantly stressing out your body,
Yeah.
you have a lot of reserve, but at the same time, you're more sensitive to
Right.
changes in your lifestyle.
Right.
So I mean, I was in Korea for my like advanced trainee fellowship,
Right.
and at that point of time, because my family is back here, and I was there for a good solid a few months by myself,
Mm-hmm.
and I had a very regimented life. The food I eat, the time, the things I
Mm.
do, and my bowel habits was like on the clock. And I think many people who experience that will understand that how when something change, it's like, oh, something is not wrong. It has always been like this, and suddenly it has changed for no reason. And that's why for people who are very active, they are tend to be more sensitive towards like small changes in their life. Like, oh, I don't usually feel so tired after I run 10 kilometers, but
Mm-hmm.
now I can't even go like 5 or 6. And you ask yourself what's happening. And that could be because you are losing blood from a
Right.
cancer. And so you're
Right.
anemic. And so you actually present then with those kind of symptoms. So what I'm offering is more of a hypothesis. It's not true. I've really seen patients that's unfortunate, as you mentioned, but
Right.
the patients who tend to have a healthier life, the saving
Mm-hmm.
grace is that they can potentially come in at the earlier stage. And the other thing that is also true is when they come in because they have a better physiology, they can withstand the side effects of the
Right.
treatment better. So they
Right.
also have a possibly a likelihood of a better outcome from the treatment for the cancer. So I think the end point of that is still to encourage, be
Right.
active as much as we can. I mean, do the things that we can help ourselves.
Right.
A lot of other things that we can't, we just have to leave it to God. Yeah.
Agreed. Doctor, how long have you been in Korea for?
Uh, Korea, how long? I mean, it was about like a duration of about 8 to 9 months. Yeah.
Okay. Let's test
Yeah.
some Korea words, all right? How do you say hello?
No
I know,
way. That was not in the script, man.
I know
Oh.
it's in the script, but it's something like annyeong, Asio or something like that. Got it
안녕하세요,
right.
여러분. 네,
There you
네.
go. You see, you have it in you. Thank you for that. I just want to test some of the Korean.
Okay, okay,
We
okay.
have a viewer right here, Zakaria, a
Yeah.
very fitness into. Thank you,
Hi.
Zakaria, for that particular question. Does excessive burping relates
Hmm.
to IBS,
Wow.
or more is it like a reflux?
Yeah. Well, it's a yes and no lah.
Yeah.
Unfortunately, it's like standard doctor answer, right? Yes and no. Okay, so uh, let's talk about the yes part because in general, it usually affects mainly the lower intestine, less so of the stomach and all. So actually,
Right.
most of the gas actually more in the center abdomen and lower part of the abdomen. So they tend to go from bottom rather than up. But because there's a lot of overlap between IBS itself and other functional conditions. So I've seen patients where they have functional IBS. Okay, they have IBS, but they also have like functional dyspepsia, which then affects the stomach as well. And so they also burp a lot.
Right.
In general, I would say in the same breath as IBS, such symptoms are generally not red flags, not to worry, right? Because I mean, generally most patients who come is their main concern is that is this cancerous, is this something serious and all. So excessive burping isn't right per se, but if it's really related to a diagnosis like IBS, then it can be treated, right? Whether it's lifestyle or some medications are pretty effective, especially for burping. Usually something that you could get even with your GPs, if not your specialist, can help you with it. Um, One of the things about burping is that because it's not just a function of gas and gut movement, it can also be other reasons like what we have this nerve called the phrenic nerve that actually innervates our diaphragm. So
Right.
like a lot of times, if you get stimulated and all, then you get like hiccups, and that
Right.
is like we're just and you just like want to burp all the time. See, and sometimes it's important to differentiate between these two because I actually had a patient who felt like he was burping, but he was actually getting a lot of
Mm-hmm.
diaphragmatic irritation because of the phrenic nerve
Mm-hmm.
problem, and that is like an entirely different host of
Right.
diagnosis altogether.
Right.
Yeah, so I hope that that answers your question. That you shouldn't be too worried about it. It can be related to IBS, but if it affects you enough, please see a doctor. Sometimes you may not know that it may actually point towards other things as well. Yeah.
Right. You
Mm.
know, to all the viewers here in following Kopi events, I think it's very important that we need to understand the body that we live in. I mean, doctors, like Dr. Chong or many, many other doctors who have came to Kopi events, I think they're studying right now, even though they are like 40, 45. Even like Dr. Chong is still studying. And, to understand the body, it's not just like, someone have a reflux and think, oh, I'm just going to the market and there's so many products. We're not going to mention the names. I'm just going to take that and then drop it into the water and I teeny, 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 and then drink it. Oh, I'm done. But then the symptoms or the sign doesn't leaves you and stays with you, and then
Yeah.
they do self-diagnosis to themselves. Say, 1 week later, 2 week later, like then the body is trying to communicate with us, but
Yeah.
unfortunately, we are not syncing ourselves to make sure that hey, let's go and check it up. Let's do it, what is necessary. That
Mm, mm.
I think, Doc. I think a lot of us
Yeah.
are not
I mean,
doing
it's a
that,
great
and
comment, Vance.
yeah,
It's a great comment. But as much as I like hate to admit it, but doctors actually don't know a lot of things. Like
right,
half the questions that you ask me is like we kind of have a hypothesis going on there, but we may not actually know what is the best fit. And
right,
and but gaining that control as an individual is still important, right? Everyone should know roughly when
right,
is it important to see a doctor. I think that's number one. You don't have to read theses or medical books for that. You could
right,
even just get a very simple consultation with a
right,
polyclinic doctor or GP,
right,
and that's it. And just pay attention to the advice that doctor gives you,
right,
and usually you'll be more or less on the right track, right? The
right,
second thing about then owning that control and the responsibility is really I would say is do what's sensible. If
right,
if that symptom has bothered you for some time and you kind of like notice that it's a pattern between
right,
some things that you do, like taking too much alcohol, or it is
right,
drinking, or it's smoking, then
right,
you should start with that first. You should start with that
right.
first. Yeah. Because
Doc,
that helps a lot. Yeah.
like what you have mentioned, right? I mean, the basic thing is about screening, and even like we mentioned and
Yeah.
stressing this a lot. Our local government is just pushing in a lot for the screening as
Yeah.
low as
Yeah.
possible, and but
Yeah.
unfortunately, a lot of us, like what you mentioned, the psychology behind that is, what if I don't want to know the
Yeah.
answers? Everybody just want to
Yeah.
live in the denial. But
Yeah.
a lot of stuff, if it can be detected earlier, wow, I think we can prevent, or
Mm.
don't need to go through that, that emotional roller
Yeah.
coaster situations. Doc, I'm
Yeah.
going to take one more question from this particular viewer, and then after that
Okay.
we can wrap it up, because
Okay,
doctor has a
cool.
long day tomorrow as well. So Mr. Harish has asked, Doctor, could you share your thoughts on understanding on reflux functions causing heart to pump more oxygen to make it weaker?
Wow, that's a very specific question. I'm presuming that came through either a medical journal or
Yeah.
some doctor's
Okay.
advice. Okay.
Right.
So so reflux functions. Okay, I'm trying to dissect it. I
Right.
presume it's stomach reflux, acid reflux,
Right.
that goes from the
There you
stomach up. Now causing the heart to pump more oxygen to make it weaker. Now that part I've not connected these two before, to
go. Yeah.
be honest.
Okay.
Because when you get acid up in the throat, they can get cough and they can present with like persistent cough, and they can also have sometimes because of that cough, the bad sleep at night and things like that, and
Right.
then they
Right.
can actually exhibit with very bad like inflammation in the throat. uh can it worsen the heart? And I mean I literally have not heard of that. So
Mm.
again, I think this is just re-emphasizing what I just said. As doctors, we don't know everything. It might come through in some funny literature. I think the best is to then check with a cardiologist
Cardiologist.
and
Yeah.
see whether that's the precipitants of your, like, I mean, what you call them, palpitations are pumping faster. But usually the commoner causes that I know as a colorectal surgeon, right, about what causes heart to pump fast is generally like either related to your hormones or related to some poor perfusion to the heart or medications that you're on. So again, I'm
Yeah.
like kind of like thinking whether it is the medication you use to treat your stomach that can cause that. And again, nothing specific comes to mind. So
Right.
unfortunately, I don't think I know the link for that. I hope you get
Right.
your answers from a cardiologist. If not, maybe we can discuss this. If you have a specific article or journal that you have, you can bring it to me and I can have a read and I can tell you what I simply think about it. Yeah. Okay.
Doc, we just planned it for 30 minutes, but believe it or not, it's 50
Yeah.
minutes, right?
Amazing. And we're still like 10 and we are still energetic. Okay. It's been
Exactly.
fun. Yeah, it's
Thank
been
you, Doc.
fun.
To
No
all the viewers
problem.
who are watching this, please do share and like. And this basically because someone, your friend or your loved one, may need it, or may just get that awareness pumped up in them. Like we always been talking about this. If our local government is hearing this, they will give us a clap, because we are pushing screening, 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 screening. That's what it's all about. Doc,
Yeah.
you won't believe it, right? Just a couple of days back, I was seeing the local news, right? They were talking about screening for
Oh yeah,
Singaporeans. Go,
because
go,
and
go.
in March this month
Yeah,
is a colorectal cancer awareness month. Yeah, so
there you
you
go.
you
We
sure
got
bound
you
to
in.
see it more. Yeah, yeah.
All right. Thank you, Doc.
Cool,
And if you're
man. Thank you
watching
so
this
much.
or hearing this, please do share and like. And you can also listen to our podcast anytime at Kopi with Vans in Apple Podcasts and Spotify as well, YouTube, LinkedIn, and Facebook. Doctor, thank you so much for spending your
Yeah.
55 minutes. I know every minute of yours is very precious, because you could spend time with your
No lah.
family.
Same,
That
same.
you choose to be at Kopi events, but it's just that you didn't have your coffee. But we're going to catch up for coffee, right? We
Okay, of
definitely
course.
need to catch up for coffee.
Anytime. Yeah, yeah.
Yeah.
Let me
And
know,
then we're going to talk
Vance.
about the offline thingy that I talked about, the ticklish.
The itchiness.
They no, some people are just sensitive, right? They may worry, how if it's tickle, but some might be just
Don't
worry
worry.
about pain. We can
And
talk
I know
about
how
that
to
and
settle
discuss.
that for you as well.
Oh, no, 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 no. All right, Doc. I think I got to lock you off very soon.
Okay.
Thank you. We got
Hey,
so
thank
much
you
of
so much.
lot of messages coming in. Thank you, Arish. Thank you, Zach. Thank you, Esther and Sinita. Thank you so much for all the messages coming in. Thank you so much, Dr. Chong. And we definitely going to stay connected and grab that coffee. Thank you, Doc. Thank you so much. Bye.
Bye. Take care.
So that's Dr. Chong, and I think I had a very great conversation with him and to understand the human organs in ourselves. But if you really talk about it, right? I mean, most of the time we fail to understand how our organs operate, at least the basic functions, right? We don't want to go into it and understand how the enzymes or how the blood goes through or what it contains and what kind of parameters we're looking at, but the basic understanding. But on a side note, right? Not from the medical part, but more on the spiritual part, or even in to be blissful or to understand what's happening. I think we fail to understand the inwards, and probably you'll be hearing this from me very often, because I always say that we always need to be in synchronize what our body is communicating with us, right? Every single damn thing, not damn, every single thing it's telling us, but we are often giving a deaf ear, right? And then we delay, we give ourselves excuses, I think that's because of psychologically we are worried, what if it happens to me? We often stay in denial, and we expect perfect life. Unfortunately, life is not such, and we often fail to understand what is our body is telling us in the earlier detections, and that's why we look at these signs and symptoms. All right, Kopi events is going on for the third year right now, every Wednesday at 9 p.m. And so many doctors and surgeons, and even doctors like Dr. Chong, spend their valuable time coming in and giving us talk and joining with me and our viewers. We hope this information actually gets out there to everybody, or most to the most, and to understand, right? Just to our awareness, you may never know, you may need it, your loved one may need it, you never know. All right. Today is a great topic. I really enjoy it. I'm sure you have really enjoyed as well. Colorectal health is a critical aspect of our overall health and well-being. Whatever we're eating, all these digestions happening, can you imagine how amazing our body is? And we hope this podcast has helped you gain a better understanding of the colorectal system, right? With Dr. Chong from the Mount Elizabeth Hospital, ARC Surgical Practices. And it's essential to speak with your healthcare provider, like what Dr. Chong has said, if you have any concern about your colorectal health. Thanking you very much for tuning in today to our podcast, and we hope you find it informative. And this is your host. Just that you're not seeing me with Kopi. Unfortunately, lots of water. You need to hydrate yourself. That's very important. I always mention this in my talk sessions. Hydrate, 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 hydrate. All right. Your body is constantly dehydrating it without you realizing. If you are feeling thirsty and if you are drinking water, well, you are probably in dehydrated. So always, okay, see, today no Kopi, just all water. So drink up, and we will come back again on Wednesday, 9 p.m. And this time, yes, I'm going to give the teaser video will be coming up very soon. Another interesting topic that's coming up next Wednesday, 9 p.m. One of the doctors is joining us from a well-known hospital. Thanks to the particular hospital, which I'm going to mention in the next few days. We are going to do a podcast there as well in the hospital, and thanking advance for the topic that's going to come in. It is Kopi Advance. This is your host, and I'm going to catch you soon. In the meantime, be good and stay healthy, stay fit, and most importantly, stay safe. This is your Vance signing off. Adios, amigos.